It probably
Oh,
can.
yeah,
You
I
need
don't
to
do it.
use the one called VO. I think VO is from Google, actually. Maybe.
Oh.
It's like the
Dear loyal fans,
best.
we have learned that for one of my smaller businesses, it turns out ChatGPT wins in terms of
Yeah,
hiring and paying.
Cat is
I
single-handedly
I still
destroying
win. I
employment in
still
America.
Yeah, it's me. It's me.
win.
Yeah. Yeah.
You hear me?
To be
Okay,
clear,
I still win. I don't get actually physically paid for this particular part. So
that's true. Melissa is free, although
but
we
you
do
do
believe
pay me.
we may have made enough money that like we can buy Melissa a nice dinner or a bottle of wine. We're not sure.
Shoot.
We don't use AI for our
There's
accounting
another
stuff.
sponsor
So
coming down the pipeline in like a week. I'm
yeah,
excited.
we have two sponsors, OMG,
Yeah,
which is
yeah.
great because
Shout out to everybody who wants to sponsor us now. We really appreciate you. That
yeah,
is, of course, all thanks to Melissa getting out there and spreading the word.
100%
This
Melissa.
is a very random start to the show. I did plug the show extensively this week, you guys, just so you know, like
I believe it.
talking
There's your
about. So
plug.
maybe there's some new people watching.
Yeah.
We got
Um,
60 followers this week, so it's very possible that that was because of
oh,
you. Just so you know.
I really did.
So,
I was talking it up. So,
love
yeah,
it.
you
yeah.
know,
We're gonna hear about Lisa's comings and goings as well as Melissa's before we
yeah.
switch over. But our favorite unpaid correspondent, Michael Marchand.
What's
Michael
up?
QXF
What's
Marchand.
up?
What what is happening lately? Michael in California, what is going
I'm
on out
launching
there?
multiple underground multiple underground podcasts. I feel very
Cool.
disconnected from my friends here, so I'm going
Aw.
underground.
This
I may
week and
be
said that.
might be doing music, might be doing video, like maybe some movie reviews. I saw a couple movies this weekend. It's like a potpourri. It's a podcast potpourri. I think that's going to be the name of my podcast.
That's
Podcast potpourri. We're going to cover
Okay.
all subject
Ooh.
areas. So,
I
Okay.
love it.
Listen,
how are
I
y'all?
I strongly encourage you to start podcast potpourri. I feel like we all have multiple many side projects, and I feel like that would be great. We can cross promote. It'll be wonderful.
It would be wonderful.
Yeah, but tell Michael, just give us like 3 lines on what is going on in health IT infrastructure in the great state of California.
Well, I got to hang out with Timmy Leslie and talk about DXF. We're putting together more. SB 660 was just passed, so they actually are formalizing the governance structure around the DXF. So hopefully we can move Pod Puri. Thanks, Scott. We could probably move to more of an actual structure and technology as opposed to what we do today, which is talk about it and make policies, but actually not get anything done. So it's a lot of effort. Moving California and the 38,400,000 people that live here are moving out, depending on who you hear, what side of the street you listen to. So, but it's all good stuff. I mean, we're trying to move forward. It's just we talk more than we do. I think execution is low on the priority scale. We want to make sure we're kumbaya state. We want to make sure everybody's in love with everything. So you hold my hand, I hold your hand, and we make everybody happy and actually not do anything meaningful. But we try. We try. So
Hmm.
I don't know
Well,
how things in the great state of Georgia.
Well, we don't do progress in Georgia, so I have nothing to report
Oh,
on health IT infrastructure. But we have we're going to talk about other projects that we're all kumbayaing on and potentially not moving forward. So I feel like we're good.
It's
So
awesome.
so we're gonna Lisa's gonna tell us about her big exciting thing that happened this week. But Melissa, you were at a tribal health IT health tech meeting or something, right?
Was that
Tell us about that.
it was really cool. I got to go and I got to sit in the listening sessions, specifically the CMS one. So what's wrong, Lisa?
I'm getting some weird feedback.
I
That's why I'm
just I
making a
just
face.
muted Michael. It must have been his other
Okay,
Was
podcast
like you
playing
were
in the
having a
okay.
background.
stroke. I got worried for a second. I was like, what's happening to Lisa?
Yeah.
Live
Yeah.
stream. Anyway, so
It's not you, it's the feedback in my ear.
yeah, okay, good. I'm glad it wasn't me. But it was, like I said, it was really interesting. I got to sit on the listening sessions for IHS, for CMS. Got to hear what the tribes were saying were important, like how uniform and flexibility, equitable treatment, and tailored support rather than a uniform approach was really important, especially for the tribes that were smaller and less resourced. how they were trying to go against they were trying to get exempt for the 340B drug pricing program. I've never been able to actually sit in one of the listening sessions and hear, them go back and forth with CMS. So it was really interesting for me. I really enjoyed it. Got to sit with some really cool
Congress
guys.
is on their side. They're going to try to axe that provision anyway. So
it was really good. I learned a lot, and I got to sit with my favorite guys, Robert Coffey and Mike Harris and Christopher Tallbear. They're going to be doing, shameless plug, a Civitas panel with me on the Sunday leading up to Civitas. So I got to sit with them, go over some of the stuff. So I had a really good week. It was long. I don't know how you guys travel back and forth from East Coast to West Coast all the time. I flew the red eye. I was a zombie all day yesterday. I'm just starting to recover. So it's like the longest conference I've ever witnessed in my life. Like it went I went Sunday. It started Sunday for you to registration and it ended today. I came home
oh my
Wednesday
God.
and did the red eye. I was like, oh, that's enough. Too much learning.
People are
The
committed.
red eye coming east is easy.
Coming east is easy. I don't know. I'm all messed up. I
disagree.
Said
Going out
easier.
west is
Not
easier.
easy.
I was telling Lisa this morning. She's going to tell us about one of her many travels. She is in the airport, in case no one can tell. She is so committed to the cause here that instead of going home, she decided to spend several hours in a pod in the San Francisco airport. So God bless Lisa. But yeah, I like primarily, I go a lot of places, but like my primary ones are up and down the East Coast. And last night, my sad little princess self, I got home at like 1 a.m. and I almost died. So I don't know how she does it. Lisa's a red eye queen. She's always on a red eye. She prefers the red eye. And every time she is on a red eye at around like 1 a.m. Eastern time, I wake up to all the texts that she has sent me telling me about her spot on the upgrade list, how likely it is she's going to make it. And then what always happens? Didn't make it.
Didn't make it.
I want to tell you that United had no internet on the way there or on the way back. That's
that checks out. That actually checks out. That checks out for sure.
happening right now.
That checks out.
Well, my trip next Friday to DC is on United, so hopefully their Wi-Fi will work because I got work to do while I'm flying.
The last one.
God bless you all.
Won't. Assume it won't. Assume it will not.
Yeah, I downloaded it at
all.
work and worked on it on a Word document and then uploaded it to the Delta later.
Kat, how's your Delta experience been of late?
Yeah, I God bless Delta Airlines. Ed Bastian. I would like to be the leader that he is for the American people. That's all I have to say
That's
about
great.
that. We were just talking about that too. Okay, Lisa, you have to voiceover tell us about your experience in New York City because the photo that you sent me of you and Sergey sadly was on our Signal chat that disappeared.
Oh yeah.
So it is not included in today's deck. So tell everybody, we'll send these jokers behind the scenes here.
Hey, jokers. We love you.
Just keep this up because it's funny while you tell us about your
It's so
experience.
funny. Yeah, I just posted about it. Not using AI, I must add. I had a great time. It says the Prax AI and Healthcare Summit for Decision Makers or Builders. I'm not sure if I have the title right. Put on by Maitri Joshi from Avon Health and a couple other folks. It was really cool. There was a ton of energy. It was really focused around like a 1 day, really high, just people with great energy, engagement, people with kind of a good mix of backgrounds from, real builders in healthcare AI. There were some VCs there. There were some policy people. But just people who had a good enough amount of knowledge to like really have meaningful conversations, and nobody was shy.
Were there
all.
any pretenders there?
There were, I'm okay. So, shout out to the group chat. If you know, you know. And there were just some fantastic people there with exactly my kind of opinion about some of these things. I do think that some of the VCs, not some of the VCs could probably eat a little bit of humble pie. And here's what I'll say. There's two sides of it, right? Like I get really annoyed now in my like mid 40s when people say, well, you wouldn't know because you're so young. I'm like, well, thank you. I know I have a baby face, but I'm in fact no longer very young. So I get annoyed when people say like you're like, oh, you're so young. But I'm sorry, like if you have not been working for an entire decade, you do not have a good view on like cycles of like boom and bust in healthcare technology. I'm so sorry, but you genuinely don't. And so maybe you should just be a little bit humble about like what those cycles mean, especially if you're talking about building generational companies. You haven't been
Lol.
working for a generation, my guy. Like, calm down. So
Yeah.
just that was the only shade. I think other than that, there was just some just really cool people, and then and who were just had really who were not afraid to like say things that were controversial or say what they were really thinking. It was pretty awesome. It's hard to facilitate a group like that and to bring people together and have them stay talking. So just like shout out to the organizers. It was really cool, super fun. It's great to be in New York. People were like, yeah, F you, this is New York. Sorry, fuck you, this is New York. And just very like, there was a lot of like being nice. So I loved it. I loved it so much.
Yeah.
And
I
that was really
I will
cool.
yeah, I'll say like God bless New York City. Like I spend a
Yeah,
lot of time as you do, Lisa, in DC, and like man, New York is the only place that you can go to
so
where they're
cool.
just like, what's happening in DC? Fuck you. Like no one
Who
cares.
cares? This is New
Like
York.
no one
It was
cares.
so
You're like, this is
cool.
New York. It's fine. Yeah. Like even
Yeah,
even people working in like policy government stuff,
so good.
they only care about New
So
York.
good, so good. I understand why the New Yorkers are like, I won't work with you if you like are not in New York. Like, go away. I totally appreciate that. It is a
Yeah.
real city. It's their only real city. Um, there was also a session at the end with health systems. So we had the whole day with like builders and people who are like insurgents, like challengers, like building stuff in healthcare AI and like really talking about it at a policy panel. And then the last session was like health systems. And this is where I would say like there is some work to do because basically the health systems were like, so here's how you work with us, and here's all the downsides and whatever. And honestly, like, I mean, shout out to Michael, who obviously comes from a health system world, but wow, like it's not easy to be a startup or a challenger or an insurgent in healthcare AI or healthcare technology in general, because health systems do not want to give you the time of day. This is known. This is not this isn't like a groundbreaking thing I'm saying right now, but like you need to be smart if you're going to try to do a pilot with a health system. You need to make sure you know what you're talking about. You need to make sure that you're really good at contracting, that you know how to really, price in a way that's appropriate for you. You need to figure out how you're going to have any kind of agency in that situation if you are a smaller, like startup health technology, healthcare AI company, because they will take your information, they will take your ideas, and it's very possible that they will then turn around and go to one of the big HRs and say, do this for me, and then accept the worst solution from that like not innovative company or not as innovative company, and they're like join our accelerator program, and it's like they don't actually want to work with you when they say that,
Yeah.
when they say
Read
like
the
you
T's
can
and
join our
C's.
innovation hub, that means like screw you.
Yeah. Read the
It's
T's
so
and C's. That
interesting.
is some
Yeah,
scary stuff. For
yeah,
sure. Yeah, we talked. I was at a investor conference this week, and that was a big thing that came up over and over too. Is like, how do you protect your IP? How do you
right,
get into a space that doesn't just disappear because it's the new hotness and some EHR decides to just
yeah.
make it. So,
Right,
yeah,
right. There was a lot of discussion about that EHR and the ambient scribe companies. It was really, again, super cool conversation. Like, shout out to the organizers. It
yeah,
was worthwhile. It was my second red eye of the month, which is disgusting, and there's still one
agreed.
to go. So, but I don't regret it at this point in time. Ask me in like a few hours when I'm exhausted and falling asleep.
Yeah, no, it's fine, Lisa. The next red eye you're doing is going to be worth it because we get to hang out. So
Oh, so
it'll be good.
God.
It'll be good. All
I hope
right.
so.
So we haven't been here for 2 weeks because we were doing real life
Yeah,
stuff. And God bless Lisa for showing up to this one because there was a likelihood that this one also wouldn't happen. But okay, so like speaking of things like the DXF that like are like everybody wants to get along and blah blah blah. I've heard some strong gossip that the CMS interoperability pledge may have already kind of stalled out.
yeah, I mean, this is a tough one. I'm actually hearing like totally conflicting things. I'm hearing like we're having problems. I'm also hearing we're going to add a bunch of new companies because there's been tons of interest. I mean, I've gotten people
Yeah.
reaching out to me on like LinkedIn asking like, how can we join the CMS health technology ecosystem? And I was like, do I look like a spokesperson?
Yeah, I
I'm
think you should
not.
do what the website says right here.
Right.
We in fact screenshotted it for you, America.
I was like,
Look at that.
please see the website. I do not work for CMS
Yeah.
anymore. Like, I appreciate it. I'm supportive. Like, I want this thing to happen, but it's been a minute. And this is, as you know, like the same old canard from me here. It's like, so implementation is really hard. Community management is really hard. It is like not a trivial thing. And I get that it's really hard for government to like pay for and support that kind of stuff. Like, the government doesn't just get to like add a bunch of people, like, fully staff up a program like overnight with people who have like deep experience in like community management, implementation. Like, that's just, they don't have a lot of people actually. So I just, I'm sympathetic, but like, I also know how hard it is to make these things happen without like really serious, like full-time people working on, you know, bringing together all those stakeholders. And you can't be like a entry-level person doing this. You need someone who's really senior and experienced and well connected to do it.
Yeah, and I think shout out to the A team. I do think
Yeah.
they've got a lot of momentum.
Start in
And
the
I
right
do think
place, but like
like the
there's
whole
not enough
yeah.
people.
Yeah, there's not enough people. And coalitions, as the bigger they get,
Oh
sometimes
man.
there's good peer pressure inside, but I don't know. It's I'm like run a consulting firm, so like no one asked me to pledge. I don't know. But we have
Scott
actually heard.
Stewie is giving a shout out for what's actually going on, so that's good.
Yeah, we should have Scott and
Nice.
team on to tell us about the directory stuff, which I know is like related but separate and all the things, but like also needed to make the other things happen. What we've heard from a bunch of lobbyists and reporters, because loose lips sink ship, I guess, is that a lot of the hang up is around data use rights, the confusion between data use rights and HIPAA, which appears to be on the vendor side.
I'm confused.
Yeah. And again, this is like a game of telephone. I think that a lot of the people spreading these rumors, probably for their own benefit, like whatever, don't always understand the distinction. Again, I don't know if everybody knows this, but we happen to be experts on data use rights.
Hey,
Just
listen.
like just saying.
Here's
So
what I
we
would
can
have said.
say this
I would
to
have
you.
I would have totally agreed with you a few months ago, maybe a year ago, but increasingly, in lieu of any real meaningful like business traumatizing enforcement, I don't know, man. I mean, is it right? Is it wrong? No, it's definitely wrong. But is it truly blocking from a business side if you just kind of wait for the non-existent or toothless enforcement? Show me the
Well,
money.
no, what I think about this stalling, right? And we may be talking about two separate things. Like I actually think that the way a lot of data use rights are written are like bullshit, and obviously like many
No,
vendors
I'm just saying.
make a
I'm
lot of
just
money
saying.
off
Like,
them.
no, we're saying this. We're saying the same thing. I'm not talking about info blocking. I'm talking about confusing like data use rights and HIPAA. Like what you were just saying. Like there are like most people don't get caught.
Well, yeah, most people don't get caught. But with regard to this interop pledge, right? Like a
Sure,
lot of
sure.
the things that they published that they would be doing, CMS wants everybody to do. Most like I know the data use rights of a lot of the vendors who signed up
And you're
because
like,
like
you
that's
don't
what
have it.
I negotiate with them for a living on them. And I'm like, you can't fucking do that. Like I know you can't do that. But here's the side story to that. They can do it if they choose to change their data use rights with their customers. Most of them
Wow.
just don't want to do it. I mean, this is the problem. This is what I've been bitching about for like 10 years with the freaking HIEs too.
Sure.
If they wanted to change their data use rights to make the data easier to access, obviously still adhering to HIPAA because that's like a fucking law, they could have done it. They just don't want to. And what they say is our participants, and this is the same thing, participants, customers, whatever, with any vendor, they don't want to change their data use rights. They say that the
Yeah.
customers will fire them. They won't do it. Maybe that's true, but I know a lot of vendors that do have the data use rights, and I'm confused because they have multiple agreements with all these vendors, and one of them is more liberal and one of them is not. And I actually don't know if everybody would fire vendors for changing their data use rights to be able to apply to this.
Well, is it like when you have a recurring subscription and your subscription's coming due for the year, and then you like email your customers and they're like unsubscribe, so you don't want to like raise your hand until
It could,
to
it could be
remind
like
them
that. Like,
that
but
they
I've
have a
also worked with a,
subscription.
I mean, yeah, like here's the thing. If you are such a shitty service that when you send your like whatever, there's lots of ways vendors do it. Like some of them do call
Your
campaigns.
renewal.
Some of it is like click the button, please, right? Like there's lots of ways to do it, but if you're so shitty that like your customers are all going to cancel because they didn't even realize what they were doing with you, like I don't know, it sounds like a different problem than
I
like
listen,
I don't know.
I am saying that this is not based on a true story. This is I
Yeah.
am very humble. Like I do not think that I'm above this. I'm just saying it just reminds me of that situation.
Yeah. Yeah. But like, okay, so here's
No
the thing.
comment.
Like, obviously, that was a big barrier. I think a lot of vendors just like jumped into this pledge because like FOMO, like totally.
Yeah, for
If
sure.
I actually sold a product, which I
Totally.
don't, I would have done that too. I would have been like, yeah, I'm awesome. Like, I can make it happen.
Yeah.
I'll figure it out. And I think some vendors,
Yeah.
according to all of the gossip from the leaky buildings here who are telling us all the stuff, they thought somehow CMS would like do a thing, which I think would need to be a law. I don't know, Lisa,
Yeah.
to
I mean,
change like so they
no.
wouldn't
Yeah.
change the
No.
data use rates.
No.
Yeah.
No. Yeah. Yeah. They're not going to do that. What they are going to do is they're trying to say, hey, you should be able to do this now with the laws that we have. Use our power of convening as the government. This is the best. This is the best, like most charitable interpretation of what CMS is trying to do. They're
Everybody,
saying,
Lisa
listen,
is
we
giving the
believe you can do.
government free
Yeah.
work right now. This is the free advice club, and you should just write it up and do what she's saying. Go,
No,
Lisa.
this
Everybody hit record.
Yeah, I mean, the government, actually, there are lots of laws that already exist, and there are lots of things that we can already do. And as Kat just said, there are a lot of choices that companies can make about how they write and negotiate and implement their data use rights and their contractual agreements between parties that don't need a new law. So what can the government do immediately? The government can use its power of convening, as it is trying to do here, to bring together a more committed group of industry participants. They're doing this as well on the insurance side. If you recall, a few months ago, they had all the insurance companies coming with a big pledge about we're going to get rid of a bunch of prior authorization, and they were kind of just saying like, you don't need us to pass a law, dummies. Just do it.
Yeah.
You can do it. And they're trying to force the issue by bringing together these key players and trying to make some of this more and more public. It's not easy. Info blocking, another example, Scott, exactly. Um, like we already have laws. I mean, could we use more? Could we use more regulations? Sure, all that is true. Whatever, in my opinion, it's true. But we assume it's not going to happen. If it's not going to happen, then what can they do? And that's this. So this is your choice. All these companies, you know, whatever the company I work for included, the companies that Cat represents included, they all can come to the table and actually do something different if they want to. And this is kind of a like we all jump together kind of moment. Let's see.
Yeah. I will just say again, American companies in healthcare, if you do not have the data use rights to do the thing, all you have to do.
I don't think that's me, which is if
I'm
if that's really what
intentional because all you have to do.
all you have to do, just cut off.
I'm gonna come here
Oh,
and visit you while
oh,
you wait
Jesus,
for Kat to come
that's
tell
too
you about
good.
data use agreements and what you have to do.
America, there is nothing you can do. That's the outcome.
Yeah,
Kat was gonna give like the secret to life, and then she like got
and
cut
then you
off,
just put it
but
out.
because no,
What that was, it just said
Kat,
failure.
no, I know it was a conspiracy theory to cut you off so you
Oh,
don't share
just
the
like
secret.
when I bashed Mickey Tripathi for Tefka and then I cut
Yeah,
off and I was like so
yeah,
mad. That was what it was. I feel like Palantir is probably watching our show. Is all I got to say about that. But I don't
I
know how
know.
they. Well, I don't know. I don't know if they're into Tefka or not. But anyway,
George
okay,
George
George. I agree. It was a
says it was a
cliffhanger.
cliffhanger.
But here's the thing, America, you can just go change your data use rights because your data use rights are not the same thing as a law. You can just go do it. And yes,
Wow,
it's going to be a pain in
wow.
the ass, but it's for America. So,
Yeah.
yeah.
Kat, how is the internet in Georgia worse than the internet in the SFO Air Canada Maple Leaf Lounge. That doesn't
Okay,
make any
so
sense
like
at all.
here's the thing.
Seriously.
It says I have the full internets, and I even restarted all of my internets prior. Ooh, I
No,
get a
no,
text
it's not
message. I
real.
wonder if it's someone telling me to go fuck myself about the data use. It's not. It's a political ad, which is just as good. Anyway,
It's
I don't
good.
know, Lisa. But anyway,
Great,
that's the
great.
point. Like anyone who says they can't do it, like you can just go do it. Like I work with
Yeah.
companies that change their data use, or they, especially like they're updating old agreements to catch up with new ones all the freaking time. You can do it.
Mm-hmm.
Every HIE in
Mm-hmm.
America, you actually can do it. And if your board says no, there are a bunch of douchey hospital CEOs who don't feel like
Yeah.
changing their DURSAs because then that makes them sad. Like, whatever. Anyway. Oh, did
Yeah,
our
I
deck
agree.
disappear? Shit.
Yeah, you
Hold on.
disappeared from you were completely gone.
Well, I don't know. I mean, that's probably good for someone. Anyway, okay. Hey, speaking of pledges, so prior, so we got some dirty dirt. We got some gossip on this via the text message.
Yeah, we did.
Yeah. Apparently, those prior auth pledges, lots of drama about prior auth, which we'll also cover because this is a Cat and Lisa show and we haven't been here in a while. But we got some dirty dirt gossip that there's going to be a convening, who knows, maybe at also the White House, which makes everybody very excited, in October about the prior auth pledge. And there are going to be some like hard requirements for standards and stuff announced at that point. And apparently there's going to be some companies who are like, I'm doing it, which is probably a good idea for the interop pledge too. Let's get some people up there. Maybe they get to shake the president's hand or something. I don't know. Go to a fancy party. But yeah, so that's exciting.
Yeah, everything is going to be a pledge, Michael asked. I think that's true. Like I just said, I think that's really like they're not going to pass any more, they're not going to do any more regulations. Like they have a deregulatory agenda. They're about to remove regulations. So what does that leave them with? It leaves them with the power of like convening the industry and trying to bring them on stage and make them make a pledge, make industry make a pledge here. I do think a lot of people generally across the industry feel like prior authorization is like it's meeting the moment, right? This is where like people are starting to converge on this has got to go or this has to get fixed.
Yeah.
So I feel like a lot of people across different parts of the industry are saying this, right? So, patients obviously saying it for a long time, but also increasingly like various types of industry players also saying it now.
Yeah. Boom. So yeah,
Got to
we'll
go.
see. I mean, I don't know if anyone's going to invite us to this one, Lisa, but
I don't think
we'll
so.
see. If we're there, we'll let you all know.
That's right.
Speaking of prior auth, this is the Wiser model. And Lisa, you know a lot about this because you wrote an eloquent
do.
LinkedIn post that was not created by AI, but it sounds like
Yeah.
there's a potential that Wiser will not happen. Tell us more.
Yeah, so Wiser is like in the middle. So the applications from companies have been submitted, and CMMI, as far as we understand, has selected some parties. But man, this has been a firebrand. Like this has been getting bipartisan complaints in Congress about it. Basically, Wiser is putting some kinds of prior authorization on Medicare fee for service. Um, but it's not quite that simple, right? Wiser, so Medicare fee for service, mostly just gets paid based on the conditions. There are like national coverage determinations, local coverage determinations, and what they're saying is in this, they're going to do a test where they bring in a post claim prepayment review and then an optional prior authorization for certain providers in those catchment areas. And it's really only for a very select set of services that are super, super prone to fraud, like skin substitutes, favorite topic. I
Yeah.
just submitted Innovator's comments on the Medicare physician fee schedule. If you look at all the regulations that CMS is doing, all the yearly payment rules, everything has something about skin substitutes because they're so bad and like so just full of fraud, like DME fraud, all the kind of stuff that's like super fraudulent and always like showing up in OIG reports and stuff like that, and GAO reports, whatever else it is. So
Yeah.
I mean, this is a test, but man, the response has not been good from
Yeah.
Congress.
Not great. Not
Not
great.
great.
But anyway, but also bipartisan. I think there was one Republican who was like, me too.
Yikes.
From Alabama.
Right.
But anyway, we will keep you updated, loyal fans, on that one. Speaking of lobbying, I think Lisa, your
Speaking
comment on
of
this was
lobbying,
your comment was Medicare Advantage lobbying is still going strong.
listen, don't ever count them out. I mean, shout out to America's lobbyists, hardest working sometimes people in America. And wow, yeah, I mean, MA caught so many strays, caught some direct hits in the last couple of months here, and
Yeah,
then somehow still they got this win. This
still
is
winning.
basically like the whole thing about MA was that like it's supposed to be like more than Medicare fee for service. As you might recall from your like health policy 101 course, you may or not have taken, Medicare fee for service only covers 80% of like basic medical coverage for the most part, and outpatient, physician, hospital, etc. And Medicare Advantage is supposed to provide more. It's supposed to provide like wraparound benefits like dental or things like that. Or, like, I don't know, a gym, go to a gym, like vision, like all kinds of like wraparound additional things, which is making more valuable and also cover like everything, not just 80% plus some copays. And
Yeah,
this rule was literally just like, if you're a Medicare Advantage insurer, you need to remind members about their benefits because people were just like not using them because they didn't know about them. And this is literally what they went after. Like, no, we don't want to use any healthcare that we have to pay for.
yeah.
So
Just read this
it was a
subhead,
little grim,
America.
guys.
Read this subhead. Fewer than half of
Yeah,
members
yeah,
use dental or vision coverage.
yeah, yeah.
Survey found. I don't know. Anyway, lobbyists are good at stuff. That's all I gotta say. Speaking of other
Well, like, but
exciting
keep in
things.
mind, in Medicare Advantage, wait, one more thing on Medicare Advantage.
Okay, okay,
It
okay.
costs the government and the taxpayers more than Medicare fee for service. The
It does.
trade-off was supposed to be people will get more and they're not getting more. So why are we paying so much more? We, the taxpayer, we, the Medicare trust fund. Guys, yeah, exactly,
That's a
Scott. That is how
boom,
they make their money. Anyway,
boom.
I
Yeah.
rest my case. Go on.
Yeah. Yep. Okay. Moving on. Yeah. Surprisingly, though, many Americans do love their Medicare Advantage plans. Surveys have also found, despite the fact that they get
Sure.
not as many services out of them. So that's an interesting thing. That's an interesting thing we can explore at a later date. Information
Yeah,
blocking. Lisa, you attended the boot camp, and the juiciest goss that I heard is that
I
no
did.
EHR vendors were approved to attend.
Yeah, or HIEs as far as I could tell.
Well,
And that was really interesting. To be fair, like HHS said that they're going to hold more of these sessions. They have plans to do more and bring more people in. They weren't trying to be exclusionary, but they did want to have a particular conversation. I don't know how that all went down or who got selected, when, where, why. All I know is that I was there and a bunch of other people. And it was cool. It was cool. I appreciated the effort. As I had mentioned, either in a private chat or publicly, Mike Lipinski is like the nerdiest government lawyer ever. And like, shout out to him. He is truly the master of like information blocking, like regulation and like legal analysis, and wrote like most of these rules over the many
yeah.
years. Like, that guy knows a lot. So, like, shout out to him. Who
You
really
did
walked
say
through
that
all of
in
the
a
like
private
FAQs that
chat.
they have. Cool.
Yeah.
Cool. I'll
It
say it
was
in here
private. It
publicly
was a
too. Shout
disappear.
out
It
to Mike
was at one of our
Lipinski.
disappearing signal chats. I can't recall if it was just me or if it was
That's
with
right.
our larger group. But you were like, this guy is the biggest freaking nerd. And it was like, what a badass. Like, it was like, all things can be true. Yeah.
To be clear. I mean, if being a government lawyer is already nerdy, then you add being like a government like health IT lawyer. You just really add the levels of nerdiness out there.
Yeah.
So yeah, that's right. As Scott notes, the group was focused on like patient either directly or as a third party vendor. That was kind of the focus they wanted to do. Um, and again, we walk through like really in great depth, and they really tried to do like a mythbusters and kind of just say like, I don't think you guys understand like the law and the regulations as they are today really should be given what we know and what we hear, should be resulting in more business to business information blocking complaints, right? it's not being reported. The 1,400 or so information blocking complaints already made, the vast majority of them are patients about providers. And given the work that ONC does, the ASDP ONC does, they hear about and know about a lot more happening in the business to business space, just simply not being reported. And we talked about why, right? Concern
Yeah.
about blowback, contractual issues, right? NDAs, all kinds of things that are stopping this. But I think generally just the concern about blowback is pretty high. And so they really talked about this in detail and talked about the kind of things that are definitely not allowed under the law. And then, of course, importantly, they announced it was the official beginning of information blocking enforcement. And they had a very, very serious guy from OIG who read a prepared remark where he was like, "This is the end of my remarks."
Even
Like
better.
fully just like the most
Even better. It sounds
the
very
most
official.
controlled OIG, very official. I was like, okay. But they have not yet announced any cases though. I think a lot of us really were expecting they were gonna say like, and we have brought like our first 5 cases and whatever is happening. But so TBD.
Yeah,
Very
you were
interesting.
saying, I wasn't there, America. But from what you mentioned, Lisa, they will be removing some of the exceptions, but there were also not really any details.
That's kind of a rumor right now. So this is also the dorkiest thing I can say in all day. ASDPONC has a new regulation that is about to come out. I think it's HTI 5 now. And we know that because it's listed as pending at OMB. That's how, that's the regulatory process before regulation is published. It goes through for the final step in the White House, OMB, where they review everything and approve it, et cetera, et cetera. So we know it's there. We know it's coming. I think it's HTI 5, but I'm losing track. And the HTA 5 is a deregulatory rule. It's a
I love
deregulatory
deregulation.
regulation. So, like, if your
Although,
brain is exploding, like, don't worry, it's actually that dumb. They're going to
Lisa, side
remove
story.
regulations.
I did listen to the Freakonomics that you recommended about air traffic control, and I did hear my best friend ever and role model for life, Ed Bastian, God bless to him, in so many ways. And they were saying that deregulation is the reason we have steerage class on the airplanes.
Yeah, for sure.
So,
Absolutely.
I guess that was good for some people, not for me. But the guy did say the whoever the source at the time, I don't remember his name, that I could just buy first if I'm not happy with that. And he is right.
That's right.
Consumer
That's
choice.
right.
Woo,
That's
that's what
right.
I'm talking about.
Well,
Anyway,
it was very interesting. He said previously, like 50% of people, like some number of years ago, 50% of people had ever flown in an airplane. And now it's like over 90% of
90.
Americans have ever flown in that's actually a huge number. So there you go.
Yeah, that's wild. That is super cool. But anyway, moving on. So this more to come, I guess. I will say there was a little bit of a fanning over of in a good way. Everybody is in love with Tom Keene, Dr. Tom Keene, medical doctor Tom Keene.
Yeah.
Yeah.
Okay,
Apparently
Dr.
he
Tom
doesn't
Keene is
suck.
he's exceeding expectations in all ways. We understand he may secretly be a fan of the show, and if so, we would just reiterate, it's probably time for you to come on the show and face your biggest critics slash biggest fans, Tom.
Yeah.
Just saying.
And then I would just like to know how much we can charge for data. That's my biggest question. How much, Dr.
Right,
Tom Keene,
right.
how much can we charge for the data? I would like to know.
Yeah, yeah. We'll
But this
see.
is also a picture still on the internet of Ava Glover and two other people I don't know because there was a lot of patient access apps. Speaking of which, patient access apps. Lisa, I think you said, we'll skip to this one. Oh, wait, we got more there, but we got that one. No, I thought I had something there, but I freaking forgot. But anyway, all these patient access apps are like raising money again. And I don't understand what investor is giving
Yeah.
these people money. Citizen, we do like this company, although I think they used to have 2 eyes in their name and then they were divested. And then I guess, I don't know if someone reacquired them, but now they have only 1 eye in their
Many
name.
lives, many different lives, many different
Upfront.
lives. But to be fair, this team has actually been doing this for a long time and has some actual knowledge of the space. So I probably would trust them more than just like someone who rolled in a bed and was like, you know what? I'm going to start a patient app. I'm going to start an app to get patients access to their data.
Yeah, well,
So,
Lisa,
we'll see.
Isn't
We'll see.
there? Um, yeah, like, oh, I must have screwed up the wrong deck here. But didn't you say someone in the audience at the info blocking thing was like the government should pay for patient access apps?
Yes, yes,
Like, what are
yes.
these people like freaking
That was like
space?
there was a discussion about like sustainability and like business models to some extent, or touched the discussion touched on business models. And one solution was like the government should do a meaningful use for patient-facing apps. And I was like, first of all, no. Second of all, not gonna happen. Third of all, like, come on, man. Like, I mean,
Yeah, like go
listen,
away.
it, I understand it. And again, like, I don't know, like that's just not going to work. That's not how business works. And the
If
problem with
there's
US
no
healthcare is
market
that
for
like
your
patients
product,
don't
there's
patients don't usually 100% pay for most of healthcare. They do pay for some things, and it's really important to focus on that and understand what that is. Patients definitely need their data, they need their information, but like if you walk into not understanding the business models in healthcare, you are not going to exist. Yeah, Erica.
yeah, that's
Erica
the
knows a
thing.
lot
Like
of things.
if there is no business model or way to make money to make it easier for your product, you don't have a product.
As they
You have a
say,
product.
no
You have a
margin,
product
no
in
mission.
search of a problem. Yeah, yeah.
That's right.
I don't know.
That's
That
right.
makes me super mad. I just think like at a time when we're cutting everything wholly in the government, like we're not going to be
Yeah.
the best in
Yeah.
research. We're not going to be the best in everything. And someone says that we should spend money on your stupid patient access app. This is, by the way, I don't think Citizen has said this. They just happened to be the slide at the time.
Yeah, sorry, Citizen. This is not about
Yeah,
Citizen. We like
Citizen.
Citizen.
We're just ranting about many of your peers, and they are annoying. Also, I think you raised money for this AI advocate thing. I don't know what that is, but necessarily
Well,
your
this
whole
was a
app.
thing. This is something that somebody
Whatever.
said. Someone said this as well in that session. They were like, they were talking about different agents that are going to be built next, basically. And we're like, what are going to be the next, what are going to be the most important AA agents? And was like, why don't patients have like an patient advocate agent? And I was like, I mean, why don't they have a patient advocate? But like, okay, I guess. I mean, if there's some way you could arm patients in a meaningful way that would work in the system, you still are going to have the problem of interoperability and data exchange that exists here that, Citizen and others are trying to solve. But it's not a bad idea. So there's ideas that can work, but again, you must understand the business models. You cannot walk in and say like, the patients are going to pay me and it's going to be enough money that I can afford to literally get data from every possible source in the world and make it usable and actionable. Dude,
Yeah.
come on.
Yeah. Yeah. And like, what's the AR or the ARR or MRR on that going to be per patient? Like what you as a patient are going to pay,
Yeah,
Lisa? Like,
yeah,
I'm not going to
yeah,
pay, like
yeah,
I maybe would
yeah,
pay $29.99
yeah,
annually for this service. I don't know. Anyway, LinkedIn user,
maybe.
whoever you are, I agree with you, sir or ma'am, or whoever you want to be today. Okay. Yeah. So
We agree.
Epic. Okay. This is,
This
what
was
was,
big news the last couple of weeks. This was on everyone's
yeah.
lips.
Yeah. So Epic
Oh
had filed a
man.
motion to dismiss all the things. The judge said yes to a few things, but according to the chief executive officer of Particle Health, the biggest ones were not dismissed.
And the
So
biggest
this,
ones were around monopolization and
yeah,
antitrust, including
yeah.
monopoly
So
leveraging. Again, this was about Epic's payer platform and Particle claiming, questionably in some cases, that they, had a really competitive payer product, which I don't think they did or do. But it's very interesting. It could be very meaningful. I think this means that discovery is proceeding. I think I read, and Brendan has written like
yeah,
endless tomes about this, as have many others. So read what they've written. But I believe because it was relatively limited, that discovery will also initially be relatively limited. But still, one of the things we were all talking about that would be very interesting was to see discovery in this case because it is so significant. Um, on the other hand, as I think we've mentioned before, you and I have talked about it for sure. It all blurs together, as you know. A few weeks ago as well, there was sort of the remedies in the Google case around
mm-hmm.
Google having a monopoly and using Chrome and using all these things to, exert their monopoly powers. And the remedies in the Google case were like basically nothing. Like the judge kind of had the choice to be like, you need to sell off like Chrome, maybe you need to
Yeah.
sell off Android. And the answer was like basically nothing. And I have to assume, if you know, like tell me, like you feel free to like send me a signal message if you work in the government. I really don't care. I won't tell anyone. But like I assume that like the president was not in the White House, like wasn't backing this judge because this judge had the opportunity to like actually break up Google. It would be very dramatic and like a big deal. But they already
Yeah.
found they were like using these powers, and they didn't, and the judge didn't do it. And so because of that, I have to just assume that there wasn't really the support from the administration to go down that path. So if anyone knows and you want to like signal me, like just reach out. I'd love to know.
You can
I won't
find
tell
her.
anyone.
She won't tell anyone.
That's right.
Not like some of our
I won't tell
reporter
anyone.
narc friends who apparently fucking tell people
That's
shit.
right.
Those guys. Fuck those guys.
You gotta know, you gotta know when to tell people things, and I just want to know. I'm curious.
So the Apple Watch now is doing blood pressure, hypertension notifications, and I just want to know how this is different from the Whoop people whose CEO basically told the FDA to go fuck themselves.
Yeah. So I mean,
Like,
Apple like didn't do that, but also like, I mean, I don't know. Do I know how devices work? No, I don't know how devices work.
yeah,
But
me
like,
neither.
also like like I know for a fact you're not even with any additional sensors, like you're not getting a reliable like blood pressure read from this thing. So like, I don't know. I mean, sure, I guess, whatever.
I don't know.
I
I'll
guess they're
probably
trying
get
to gather a
one.
lot of data over time. Sure,
I'll
why
probably get
not?
one because they look cool, but not
They look
not so
cool.
that not so that it tells me if I'm doing something wrong. I'm not
Nah.
interested in that. Yeah, we had the Maha Make Our Children Healthy Again report, which is different than the very exciting, not yet released, big Maha Commission report on just America. But this one, there's I mean, like, I honestly don't think there's anything terribly controversial in here. Like, I mean,
Well, it
they're
was
gonna make
very, very watered down. Like stuff didn't make it into the draft report. There was stuff in the draft report that didn't make it to the final report. And fundamentally, I thought we were gonna go like full bore and be like, pesticides bad, right?
yeah,
Dye,
pesticides
food dye
were
bad. Like yeah,
yeah. There are
exactly.
many Maha people who are very disappointed that this did not include a ban on pesticides. But like, I would just like to say, this is not like a health tech talk show related thing because this is not health technology. However, I grew up on a farm. We grew a lot of grain, and like, Lisa, have you ever planted like 500 acres of grain and not used pesticide?
I have
No. Well,
not.
let
I've
me
only
tell you what
planted
happened.
like 1 acre. Like
Here's
one
the
acre.
situation. This is actually like a really delicate thing. And I do eat organic food. I have a garden, all those things. However, I did grow up on a farm where we produced large amounts of grain and hay. And if you plant grains or really any produce without pesticide, it requires a significant amount of manual labor to produce anything close to the same amount of produce that you would be able to harvest with pesticide. That is an actual fucking fact.
Yeah.
And guess
Yeah.
what?
Yeah.
We just
Yeah.
tossed out all of our immigrants who pick all of our produce and would potentially do that manual labor. Like, you kind of can't have it both ways, y'all. Like, it actually would massively disrupt our food supply
Yeah.
if we cut out
Yeah.
pesticides. And I
Yeah.
know, like, I choose to avoid them. However, not
Yeah.
everyone in America can. It will increase the price of our food dramatically. I'm not saying this is like a Farm Bill hardcore loyalist. I'm just saying, if you ever, the Amish, as an example, do not use pesticides. In some cases, some do. You will look at an Amish field and a traditional conventional farm field. One of those is getting a whole shit ton more food than the other, and it would massively
No.
disrupt our food supply. So,
Yeah. Yeah.
there's
Yeah.
more to it
Well,
than, just cut
right.
it all out.
Right. Here's the thing, like I'd be more sympathetic to some of the other arguments if we were really like, we are going to reform our food system and we're going to do it this way because our food system is making us sick. But that is not really what this says. And
Yeah.
yeah, not that great.
Yep. Anyway, so more to come on this, I guess, but I know a lot of people are disappointed it didn't go far enough. I don't know. Speaking of all that stuff with AI and HHS and all this stuff, it turns out that the government is now using ChatGPT as well as my foundation.
Yeah. in the panel that I was moderating and in a discussion later on as well. One of my panelists, I won't out him here in public because I think we were supposed to be off the record, was like, the government should use AI to like improve regulations to like go through everything with fewer staff, whatever it is. And I mean, I think it's fine. I just think the problem, of course, is that people don't understand the limitations of these kind of tools.
Yeah.
And also, of course, there are privacy and security rules that IDK if they're being followed here.
IDK. I mean,
IDK.
also, like, I think if you read this whole piece, it does say, like, I guess the guidance from the SEC was make sure to like trust but validate type of thing.
Uh-huh.
I mean, I don't
Uh-huh.
know.
Have
I
you
will
met have you
say,
met human beings? Human beings are not
yeah,
great at doing that.
I don't, yeah, there could be some mistakes made here, but TB, I guess we'll see how it goes, you know. Speaking of AI, this is a continuation of the debate on should we have a reimbursed CPT code for the AI? And like, I just
No.
don't think so. Because here's the thing, and I have a nice, so I read this piece and this nice gentleman, and I was at this investor thing where another lovely person who probably has 20 years less experience than me was telling me about how the labor code and RAV and all that is just like not useful, and we need to get something else for AI. And I was like, I feel like we're just on different pages here. Like, I just don't understand. Because here's the thing, if we're looking out for America, what's best for reduced costs overall in healthcare and better patient outcomes, I fail to see how like getting a reimbursed code for AI does either of those things. All it will do, which I'm sure is the point of all these people writing on the internet, right? They all either sell AI products or they're venture capital firms that are backing AI products. If we have a reimbursed code, we will have more AI up front. And we have no idea if that will work and reduce costs and improve outcomes long term. Why don't we just follow free market principles and whatever works, we keep doing, and whatever, like, why do we have to have some crazy bullshit thing is what I want to know. And Lucia, God bless Lucia, agrees with me on the internet. Although she disagrees with me about meaningful use, I do think meaningful use was bullshit and caused a lot of the problems we have today. But she's like, we don't need MU for AI. Totally agree. I don't know. Like, I just keep seeing this everywhere and I keep hearing it. Like, everybody's in the same talking points about the labor part of billing. And I'm just like, I just feel like that's a dumb argument.
Lucia is saying the ultimately right thing here. Let's not do meaningful use for AI. That's right.
Yeah.
Exactly. You know, I am very much of the vision that AI is normal technology. I'm not the first person to say that. And I do not think that we should specifically incentivize it. We should specifically incentivize like doing whatever it freaking takes to get better outcomes in healthcare. And that means better quality, better health outcomes at a lower cost. And that's it, right? Like, cool, do use AI. Great, awesome, do that. If you can prove that you're actually improving outcomes, not just funding a bunch of AI and healthcare companies and like
Well, that's the
laundering
thing.
money. All that
Yeah.
that's
Like,
what it is.
if
Like,
it's
do
useful.
get better outcomes using technology. And Lucia's right. Actually, I just submitted the comments for Innovator. Everyone
Yeah.
else who works in the space probably did this too. This is in that specific proposed rule. There's a request for information about how to pay for these pay for AI. Should CMS pay for this in some way, pay for SaaS products that have AI in some way? So you can answer this question by midnight tonight. If you're curious, you can just go and search CMS 1832 proposed rule. You can just submit your thoughts just on that. You don't have to do anything else. If you have thoughts, go tell CMS they are accepting comments until midnight Eastern tonight on this question.
Yeah, boom, do it. Yeah, I don't know. I think we should
Yeah,
just focus on
do it.
value-based care. I recognize that will mean less AI is
Outcomes.
adopted at front, but I honestly think we should let all this crazy tidal wave AI stuff blow out anyway, because to the point here, we'll go back to this one.
How is adoption the goal?
Oh
Adoption
yeah,
isn't
I'm
the
like, oh,
goal.
I don't
Like
have
we can't.
all
It's
of
not
my
about just
charts in here. I screwed up, Lisa. I have the Oracle
wow.
price chart, the price surge. If everybody has seen, Oracle
Oh,
has jumped in price by an astronomical amount. I don't know if I can share it, but I was supposed to be in here. But yeah, to this point, like we pretty much, what are they calling it? The fiery AI bubble. I don't think we need to like flood the
yeah.
market with super baby solutions in healthcare and pay for it and then wonder why they all fail.
I
But
wonder
anyway,
why the
Oracle,
cost of healthcare just increased again.
Yeah, Oracle launched a thing. They launched a payer platform, I guess, to rival Epic's payer platform. And then, as Brittany Trang here notes from Stat, apparently in Seema's speech, all she did was joke about Epic and then compare them to Epic the entire time. Y'all, I continue to question Oracle's communication and marketing strategy. Everybody knows that when you are launching a product, you do not compare yourself to the market leader. You just talk about why you're better.
Don't invite comparisons like that.
Yeah,
It's
exactly.
not good.
I'm so confused. Like, I just I continue to be like, again, I've never seen Oracle's product. I have no idea if it's freaking good or not, but I do know their communication strategy is like absolutely one that I don't think anyone would recommend. And I wonder what the internal communications people think. We should have them on the show. AI people or communications people at Oracle, please come on our show. You might get fired.
Signal
So
chat us,
we'll
please.
like put like a word blur over your face. I don't know. So yeah, and then in sad news in America, because we're running out of time here, I guess the US government destroyed all the contraceptives that we put in a warehouse in Belgium for reasons unknown to us.
Yeah. Sad public health news. I just think like the underlying thing here is like we're spending all this time, the whole industry, about like, oh, how can we like push AI adoption? And it's like public health is collapsing. Y'all, like prioritize. Let's focus on making sure that we do not like completely lose our shirts on public health. Like it is very bad. We are at risk for pandemics all the time. We have all kinds of like underlying problems, destroying like medicines and contraceptives and things like that, and not providing vaccines for like childhood illnesses across in the country as well as across the world. Like this is table stakes. Like everyone should
Yeah.
stop doing what they're doing. If you work at an AI company, stop right now and just work on public health for the next 10 years. Thank you.
Yeah, that would be great. That would be
Public health.
great. Where are the AI public health companies? Maybe I don't even know. But this
Oh.
is dumb. It's like why? I don't know. But I'm going to move on. In great great news, the state of New Mexico has decided to make childcare free for all of its residents.
Yay.
Someone
Amazing.
cares about women and their workforce and their communities.
Yeah.
God bless New
This is
Mexico.
cool.
We are with you. You are the best. Congratulations.
These
New
are the
Mexico.
kind of
This is
things
very
you do
cool.
that will actually improve like health outcomes and economic outcomes in your state, for example. So if you want the free advice club here, if you run a state or whatever, like do this. This is cool.
Yeah, very cool. And then I actually don't know if I have it in here because my slides are messed up. But speaking of childcare, we have not been around, but as you all know, Lisa's technically my boss on the board of Zoria Foundation. I'm the CEO, and we exceeded our goal like within just a few hours. For raising 5 new childcare grants. And then as the week progressed, we got a lot of like random donations of people we don't even know. And they got us an entire extra grant. So the end of a week running this
awesome
campaign, $72,000. That means we'll have 6 new full year grantee moms that we're selecting now. So go on our website if you know anyone who needs help with childcare and is also a healthcare worker. Go apply, and we're going to start that new cohort in December. So very exciting. We're in the middle of our second cohort. We finished our first one at the beginning of August, so it's really cool. These are small groups. One day they'll be bigger, y'all. But today, this is what we got.
Yeah,
so,
yeah.
So many of our
It's
viewers.
still a big deal. That's going to be 6 people, 6 women working in healthcare who have an entire year of childcare grants coming to them. And
Yeah,
that will
freaking
make a difference in those people's lives. And so shout out to all the people who donated. Like, you're awesome. And especially shout out to our surprise mega donor. You're extra awesome. Everyone's awesome, just to be clear, for donating $5 or, in this case, like $12,000, but like is a big deal. It was super exciting.
Yeah. All of
And,
our
like,
donors are amazing.
This made our day.
Like,
for
yeah,
sure.
and even if you're liking and sharing our stuff, we know a lot of people, like right now times are tough. Like if you're doing anything for us at Zoria, like that's freaking awesome. But yeah, random donor who came in unknown to us and then was super polite and said, no, please don't write a dramatic post about me. What the hell? Like, how do I get some of that humility? I don't know. But yeah, that was really cool. So we're excited about this one.
Please don't write a dramatic LinkedIn post about me. I'm just trying to donate to help moms.
Yeah, I'm just trying to do a nice thing. Was actually kind of what it said. So I was like, okay, I'm not really sure what to do about that. But anyway, other news that did not make it into this deck because, I don't know how to do decks, I guess. Bill Cassidy, it's his picture, but Former CDC Director Susan Menares will be testifying in front of the Senate Health Committee on Wednesday. It sounds like she is going to have to address the fact that the secretary said that she's a liar. So in a weird statement that she apparently just said that she is not a trustworthy person. I don't know. We'll see what happens there. So it should be big, exciting times. And in other exciting news, which
Only sometimes trust. I mean, I'm trustworthy in the sense of like I will like try to not crush you. I'm not evil, but I am forgetful. So in that way, I'm not a trustworthy person.
Yeah, I
I'm
don't
just telling
think
you,
that's,
Kat, in
I'm
case
just
you
saying
decide
that's
you need to fire me.
probably what he said. Fire you from your unpaid job at the Health Tech Talk Show
Probably not what you would say.
anytime, Lisa.
Amaze,
Anyway,
amaze,
so other
amaze.
exciting things that are sort of happening because our show's over. Oprah's coming to Health, and so are we.
Yeah. Yay.
Yeah, we're
This is
coming to
very
Health
important.
again.
I did talk about this. I also, like I said, I plugged the show at the Prac Summit, and I also, talked to a few folks and suggested that they send us a line and tell us why they should come on the show. We are doing live shows again, as we do every year. And so if you are hilarious, you have an opinion, you want to chop it up with us at Health, Melissa will probably drop the link where you can go and apply to, appear on the show. Again, this is live in person. You must already be going to have a ticket. You have to be registered to get in. If you're already there and you have something to say, and you want to be on the show, like drop us a line, and
Yeah.
Melissa will put the link in and come on the
Yeah,
show.
that's
It's
it.
gonna be great.
Yeah. We'll be clear. Do not
Yeah,
say you're coming on the show and then the day of the show tell us to go meet you at the bagel shop around the corner because you are not buying a badge.
that's
That's
not gonna
dumb.
happen.
You
It's
have
not
to
gonna
be
happen.
badged.
No.
We do our shows live. All it like everybody comes to the show, so that is dumb. Do not ask us. And also don't come on the show if you just want to talk about your product because it's probably not going to go well.
Yeah. And if this is your first time watching the show, usually we have a guest. We are just a little bit unhinged today because, of course, I'm in the airport, and also we've been
Yeah.
off for multiple weeks and stuff has happened. So normally there's a guest on the show, and we'll be back with more ridiculousness very soon.
Yeah. Scott, are we doing live lines on our show? If someone wants to sponsor live lions
Yes.
coming on our show, we will happily do that. So, okay. Well, Lisa's got to go home. I got to feed my
Correct.
kids. Blah, blah, blah. You guys are the best. God bless America. See you soon.